And now, it's Boomer Life, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on CIL 650.
Well, we will try to bring you some news today. Welcome to Boomer Life on CIL 650. I'm George Gordon, and today we're focusing on your health. In studio with us today is Dr. Paul Zickler, the man behind Yes Wellness. And it is a great resource for finding not only the traditional but newer ways to help you live and feel better. Dr. Zickler, the medical director at YesWellness.com. He's been medical director for over 40 years, brings a wealth of knowledge and experience to the team. Now, as a medical director of Yes Wellness, we talk about some of the experience. Let's talk a little bit about where some of the things that you've learned and some of the things that you now believe in came from. And you saw people coming into a hospital at the worst point that you can see somebody in their health situation.
Well, yeah, that started out in the emergency department. And that's where I was for about 18 years of my 40-year career, and it really was an excellent time for my development in terms of medicine. I really enjoyed those years, especially the first 10 years, because we were right at the beginning of what emergency medicine is today. Basically, we were just some GPs that worked full-time in the emergency department, and we had to hone our skills to fit the department by ourselves. Our group was very instrumental in being developers of the core curriculum for emergency medicine, for the training of the paramedics, for the air evac system, for helmet legislation, seatbelt legislation. We were a very really dynamic group that we did a lot of good things, and it was really exciting. But you know, I was never really destined to work night shift for the rest of my life, and that combined with sort of the change in funding, which led up to a backlog of healthcare in our emergency department, which is not any better today than it was when I left. In fact, it might be a little bit worse.
Wow.
And yeah, there was one Saturday night. I was in the department by myself and had a traffic victim that was a 17-year-old, and she became paraplegic amongst multiple other injuries. And I spent the whole night trying to get a bed for her somewhere in our lower mainland in the ICU because she had a spinal cord injury. And I didn't get her placed till the next day at 10 o'clock, and my shift ended at 8. So after I got home, I said to my wife, I said, that's it. I got to look for something else. And so I just casually mentioned that, you know, I think I'm going to go and open a clinic that would be walk-in, but it would be sort of emergency orientated, where there would be a suture room, a cast clinic, an eye room, basically to see those things that we're seeing as a sort of walk-in wounded in the emergency department, but another place for people to access. And 4 of my partners said, geez, I'm in. We're all going to do this. So 5 of us left the department, and we opened over a period of years 3 walk-in clinics. And with that principle in mind, seeing patients, managing their problem, and sending them back to their family doctor. Well, the success was the demise of the system, because people then in follow-up after they had the sutures went to get them out with their family doctor, but they couldn't get in a timely fashion. So then they came back. And similarly, if we started some investigation or something acute, they couldn't follow up, and then they came back. And so we had this situation where people were coming back. And now you see walk-in clinics basically are family practice clinics with open spaces for walk-in patients, which is really good. But then the sort of your expertise in dealing with complicated lacerations, casting and fracture management, and doing a lot of those things is not your level of expertise. So, you know, people end up going back to the emergency department for a lot of their things that could have been managed in a situation like we had initially. Path
of least resistance.
Exactly.
They helped me there. I'm going back there.
Yeah, exactly. But during that time also, my daughter went into naturopathy, and I was quite interested in her choice of healthcare. And this is a long time ago, so naturopathy was just in its infancy in terms of especially Canadian practitioners. And so I went down to several of the courses that were held at Bastyr, which is in Seattle, and it really started to open my mind as to other alternatives to allopathic medicine. And I incorporated many of those things that I learned in my practice, and was amazed that they actually worked. And so I was really, that was really the turning point in my career in terms of looking at outside the box of allopathic medicine or westernized medicine, and opening and reading more material, talking with other people that are experiencing the same thing as I did. And that's really that led to the development of Yes Wellness. During that time, we also started an online pharmaceutical business, which really led to me being comfortable with the online world. And Yes Wellness deals with basically supplements and nutraceuticals and wellness and healthful living.
All right. Now, these are substances that you've researched, and you're comfortable in telling people how it can help them and in what combination and so on, which is very important. It's not just a product. This is something that you believe in. Just before we go on, and I don't want to just miss the opportunity. When we talk about allopathic medicine, we're talking about Western medicine?
Yes.
Okay. And naturopathic, I can remember 40 years ago, if you would mention that word, people would, sort of cringe back and wonder really what's that all about. But it's becoming not just accepted, but practiced also by the people who were allopathic in their beliefs.
Well, yeah, that's what's really interesting, George, is that what I've seen now, when I first started my interest, whenever I mentioned it to any of my colleagues, they all turned the eyeballs up and sort of, and I knew they weren't going to listen to what I had to say, so I never really said anything. And but over the time now, especially in the last probably 5 years, I went to a holistic medicine, and you'll hear the terms holistic medicine, integrative medicine, functional medicine. They're basically similar. There are some differences, but their basic concept is similar. What they're trying to do is look at the root cause of your illness, and even going a step before in preventing those root causes and being well and leading a healthful life, so that you're not going to be disease orientated, which we are in westernized medicine. We are treating diseases, and we're really good at the acute. So the surgery, the acute illnesses, if you're really, really sick, we do really well at those. But we're not doing so well is in the chronic illnesses. So once we've gotten to the point, okay, this is what you've got, these are the pills we got, you're on these pills for the rest of your life, everybody's happy, the pharmaceutical company's happy, they're going to be selling you that drug every day of your life. And maybe it'll be twice a day, it'll be even better. So the focus has been lost in that chronic care, and the problem is that those chronic illnesses have become epidemic in the last 20, 30 years, and so we're seeing more and more of these people, but we've got nothing to really offer them in terms of changes, whereas sort of the allopathic or the non-allopathic, so the complementary, the naturopathic. And there's several other people in there: the holistic nutritionist, the massage therapist, the Ayurvedic medicine, the traditional Chinese medicine. They all have something to contribute in that category of complementary medicine. So back to the holistic medicine conference. Well, when I got there, it was just overwhelming to me that there are people that are actually think the same way I did, and that there actually were allopathic medicine that were incorporating complementary medicine into their treatment modalities. And it was an eye-opener, and it was really fun and exciting. And now you're seeing an increasing growth of allopathic doctors that are interested in complementary medicine, incorporating them into a treatment pathway that incorporates both sides of the spectrum for the betterment of the patient.
I think in this day and age, as the boomer generation gets older, boomer life, we're not talking about the people at the 40 end, we're talking about the people now into their 60s. And many have been living with chronic situations, and the standard sort of treatment has not perhaps worked. And the other thing that the boomers have to worry about is keeping the mind active. One of the things that we want to do here today is talk about brain health, and we'll focus on that and what you can do. Now, you have 9 steps. We're going to try and get through some of these today, and if not, boy, we'll get through them in future programs. And I want to remind you at this time that you can go to YesWellness.com. Read that page. They have all kinds of information on services, treatments, the different kinds of products that might help you, and always they advise you to seek advice from your medical practitioner, whatever shape or form he or she comes in. But also, there is an opportunity here to ask questions. You can write your questions in. There's a spot there at YesWellness.com, and they will get back. Maybe not right that second, but I think they promise you within 7 days they'll get back to you.
Yeah.
All right. Well, let's talk with Dr. Zickler some of the 9 ways that you can help make yourself smarter. And I know that I get a little panic-stricken sometimes. Where do I put my glasses? And my wife points on top of your head, dear.
Yeah.
Exercise. Boy, I have learned this so, not so late in life, but how important it is as I've grown older to maintain a form of an exercise regimen.
Well, we've stressed this in past sessions, and leading a healthful life is not just something that's important for your physical function, but for your brain function. And basically what we want to do with our brain is we want to do things that increase the brain cell regeneration and new growth, make it effective in terms of how they transmit stimuli, and help them repair damage that's been taking place. And all those 3 things you can do by exercise. And it's always amazing to me that, I can remember telling my patients when they finish their physical, and in terms of giving them advice at the end, I'd always say, listen, I want you to stop smoking, and I want you to do some regular exercise and watch what you're eating in the last 2 minutes of my consultation, and then wish them on their way, and then wondered, how come they're not doing those things? Well, I gave them explicit instructions of how to take the pill they did,
right.
But I really didn't give them any instruction in terms of what to do when I said, start exercising, eat healthfully, and live well. So, yeah, exercise. And what's interesting, when I told them that 20 years ago, there really wasn't a lot of evidence, scientific evidence, that really did do wonders for you. But the evidence is increasing every day that exercise, and along with exercise, is healthy eating, using food as a medicine to do those things that are really important, especially in your brain health, besides just your regular function.
All right, let's talk a bit more about that in our next segment. You're listening to Boomer Life. I'm George Gordon. Today, we're talking about your health, and joined in studio with Dr. Paul Zickler, the medical director from Yes Wellness. You can get more information about what you're hearing here today at YesWellness.com. This is Boomer Life on CIL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CIL 650.